So good evening, everybody. Thank you for joining us once again. Today, we are discussing a topic that is very dear to my heart, more so that is Cancer Prevention Month. We're going to be looking at lifestyle choices that we make to help with cancer prevention. I know cancer has been something that I think almost everybody or every family can relate to. You know, it's been, you know, for want of a better word, it's been a challenge to us health-wise. We've lost a lot of people to cancer. So I just thought it'd be a good one this month. That is Cancer Prevention Month, or yes, Cancer Prevention Month, to bring up the topic and see how we can help ourselves. You know, if it's something that is a disease that is preventable, to see measures we can take in our lifestyles, in our habits, to, you know, just have a better life and a longer life, you know, so that we are not unaware of these things that can easily be prevented, that, you know, we don't take seriously. Okay, so Dr. David, I'm glad you know you are on. My first question would be, when they diagnose people with cancer, in medical terms, what really is cancer? Because, you know, there's cancer of this, cancer of that. What really is cancer?
Okay, so basically, cancer is, for sake of better question, now it's basically the change in the body cells are.
Sorry, you're not audible enough. Can
Can you hear me?
It's not too clear.
Let me see. How about now?
Yes, a little better. Yes.
Okay.
Okay.
So, when we say cancer, basically it is the change in the cells. So cancer
Okay.
basically is in the cells.
Okay.
So it's basically what we call metaplasia and hyperplasia. So the
Okay.
cells are now replicating at a much faster rate, and they are
Okay.
now from their normal structure and function into something
Okay.
entirely.
Okay.
Yeah,
So
and you're right. There are different types of cancers.
yes. So just to, you know, like make it more audible. So you said cancer is when the cells begin to change, right?
Yes, so the
They
cells,
change from their normal structure. That's how you
yes,
are able to detect that one has cancer when they go for checkups, right? Or for for checkups.
for checkups.
Yes.
So usually the best way to detect cancers is a biopsy.
Okay.
Cancer from the biopsy, we look under a scope, and then we now see that, the normal way the cells should be, it's
Yes.
no longer that way. It has
Okay.
attained some form of mutation. It's now
Okay.
different than supposed
Okay.
to be or what it is.
Okay. Okay. So
Certain cancer cells have specific markers
they have
and
specific
specific
what? Sorry.
there are specific markers and specific features.
Okay.
Yeah, so we then now look out for those features, whether
Okay.
it's from pathology slides or if it's from a blood test.
Mm.
Then the markers, depending on what cancer we're thinking of.
Okay. All right. Okay. So what normally are the physical symptoms of cancer? At what point should somebody actually be serious about going for a checkup?
Okay, so one of the major ones is weight loss.
Okay.
So unexplained weight loss, persistent unexplained weight loss. You used to be 80 kg with minimal to no exercise. You are now 65 kg. You're coming down to 60 kg. You definitely should go get checked up. You should
Okay.
go. So it's something of concern. It's better to go and they say why you here and everything is fine. You know.
Okay.
Also have night sweats.
Okay.
Night sweat, and weight loss, change in appetite. Those are some of the non-specific um, body symptoms of cancer. Then
Cancer.
we start
Okay.
specific ones depending on what organ is affected. So
Okay.
it's say the lungs, you can start to have cough, prolonged cough, coughing up blood, coughing out mucus like, no longer colorless, maybe brown or a woman who is menopausal having bleeding from the vagina, it is never a normal thing. It should always be investigated.
Okay. Okay.
Okay? But usually, depending on the end organ that's affected, there are now
Mm.
more symptoms, and also depending on the type of cancer, is it a rapidly generating or progressing cancer? Is it
Mm.
one has spread to somewhere else, or is it confined to the primary organ? So the symptoms can be more specific, which is
Okay.
where is it? You say, I was just losing weight, so I've just been coughing for months,
Mm.
nothing, and then it's
Mm.
actually
Okay. All right. Some of the symptoms you actually described are similar to what I experienced when I had when I was before I was diagnosed with hyperthyroidism. And you said the weight loss. You spoke about the diet, like what do you call it? Not diet. You said when you lose your.
second.
So we're just talking with Dr. David on what cancer is. I think he's gone off. I'm trying to add him back, just to kind of understand what cancer is. We always hear about cancer. Some of us have lost loved ones to cancer, and it's like, what is cancer? Sometimes it just feels like it's a name, but I don't know. Sometimes just wanted to know, when they say cancer in medical terms, what does cancer mean? So he said that normally cancer is when the cells begin to change, the structure of the cells begin to change. And I think he also spoke about the rate of is it replication or reproduction of the cells. That such kind of things are some kind of pointers to the fact that there may be a cancer there. And he said that there are different types of cancer, which we all know. So I went on to ask him that, so what are the signs, physical signs of cancer? What would you look out for to make you want to go and get checked for cancer? So he was saying that weight loss, spoke about weight loss that is unexplained. He spoke about change in appetite. He spoke about, there were a few things he raised because he wasn't too audible, but once he comes on, I'm sure he can, to take us through them once again. He's probably looking for better network area. So we'll also direct the same to you as a dietitian. When the health practitioners talk about cancer, what is cancer? What would you describe as cancer? Like, you could probably maybe shed light to what Dr. David had said.
Just like what Dr. David has said, is just basic.
Mm.
It's not basic, it's a whole lot. Cancer is a
Yeah.
lot, right? So it has to do with
Mm.
our cells, the generation, the DNA and all. So
Yeah.
it's cumbersome, really. Cancer is not this
It's
is
not
an
easy to
emotional
define. I know. Same here.
yeah, so it's a whole lot of body the cells degeneration and all. So
Okay. So also, what signs would you look out for to know someone has cancer? Because some of the signs he described actually were similar to what I also experienced before I was diagnosed with hyperthyroidism. The change in diet, change in appetite, the extreme weight loss. I think my skin color changed as well. There are some things he mentioned that were very similar to what I experienced when I had hyperthyroidism. So what are some things to look out for that would make you go ahead to go and get checked?
honestly don't recommend a particular thing to look out for, because if we're looking at the unexplainable weight loss, kind of, which is one of the most commonest thing, it can happen with other conditions. Some
Yeah.
people who get diagnosed with diabetes, they start noticing the whole weight loss, unexplainable weight loss, right? So I like to say, just check. That's why it's necessary to go for the routine medical checkups, right? So really don't have to wait for symptoms, because sometimes there are no symptoms. Yeah, there could be symptoms where you begin to notice your nails, fibrils, all those, the weight loss, discoloration of your skin and all. But those are not enough, because there could be other things that can be attributed to that. So I like to say, just check. Okay, like in the case of cervical cancer now, once you know you are active, you are up to the age of 21, you need to really check. You need to check, because sometimes it could be lying low there without any symptom, and that's why when people are diagnosed, before you know it, they move from stage 1 and they are in stage 3. So it's actually better to check, because detecting it early is one of the ways to really manage it.
Okay, that's good. Okay, so another thing is there really a particular diet that would help in cancer prevention? Is there any particular kind of, diet routine you should follow, lifestyle pattern you should follow, exercises and all that?
Yeah, so when we say prevention, yes, but there's no particular food, right? Dr. Dave is back. So there's
Yes,
no
I'm
particular to say, oh, this food in particular is to prevent or to stop or to avoid cancer, really.
Yes.
Okay, but healthy lifestyle, wholesome foods and all will, to a certain percentage, help us prevent cancer. But still, there are a lot of people who do those right things. You eat healthy and you still come down with cancer, you get? So that's why I'm saying it's a whole lot, really. It can be really depressing. So there's no particular food. There's no one food you mentioned. You say this is a super food for cancer. Okay, for cancer prevention. But yeah, any food rich in fiber, antioxidants, which you get from your plant sources, your fruits, your vegetables, okay, they help to prevent cancer to a good percentage. Yeah.
It's very good that you said that, because I actually lost someone to cancer. Like when you said it's a very sensitive and emotional topic, it's the same with me. It resonates with me very well. And even when the show was starting, I was saying that this is it's a topic that is very dear to my heart, because it touches very sensitive parts. So my father, actually this month, about 12 years ago, passed away from colorectal cancer. So he was someone who was extremely health conscious. He never ate outside. He eats at home. Doesn't take sugar. As far as I remember growing up, I can never recall my father having, like, even if it's fried food, he's so particular about what you give him and what he puts in his, in his mouth. He was when it comes to his routine checkups, he's never, he's always on point with that. And even down to the hospital he goes to, and the doctors, he was someone that was very particular about his health. So I was very shocked when the type of cancer he even, suffered was supposed to be a lifestyle caused cancer. So it's very interesting that you say what you have just said now, that you could do all those things and still, get cancer. So I would agree with you that it's very important to just make sure that we do our regular checkups. It may not necessarily reduce the risk of it, but I think at least it keeps you aware, for longer, that you have this ailment and you have to take measures to deal with the ailment. I'm not really sure.
And the most important thing about checking is that when detected early, it's easy to manage. There is a high percentage of recovery when detected early. So that's why that's the essence of the regular checkups. Yeah.
Okay. All right. That was because I was going to just ask you now, is it actually something that is treatable? But you've answered my question already. I guess it depends on the stage that is detected and then you treat it. Okay, so
people are cancer survivors, of course. Yeah, it is something treatable, right? But that depends at the level it was discovered and the impact of treatment on this individual at the point. So, and for me, what mostly takes us is really not just the disease itself. It comes with a whole lot of mental draining, financial drain, and sometimes the money isn't even there to, get the
Yes.
proper treatment. So all of those
Mm-hmm.
actually leads to early death. But
Mm.
I like to say that money is actually good.
Yeah, in that context, it is really, you know. So, so these regular checkups we're talking about, how often do we need to do them? How important is the regular medical checkup and screening?
We can do annually, really.
Okay.
Yeah, it's important.
Okay.
If it's something
Okay.
you can do annually. Hey, Dr.
Okay.
David, welcome
Dr.
back.
David, welcome back.
So I have a little
Welcome back. Yes.
It seems like you are at work.
it feels like
He's
you're
in
at work.
scrubs today.
Are you
Okay.
at work?
Yeah, I am.
Oh, well
Yeah,
done.
a
Well
bit.
done.
Yeah. Okay.
All right.
Uh,
So
just
good to have
to,
you back with us. So we're just going over what we had discussed with you and what you had said about cancer. And then I shared my own personal experience or story with cancer about how my father, who I know was the most health conscious person. I don't even come near, but yet he died of colorectal cancer. And actually February, I think what February 2014. So still this same month. And it's 12 years today. So for me, it just felt like, is there really, an answer or a way out of this cancer? If someone like him that was very particular about what he ate, up to date with his checkups and all that, but it still happened. So that Grace was enlightening us on the fact that it's treatable if it's detected on time. So the best way to probably avoid it is to make sure that you don't miss your screenings. You don't have to wait to have the symptoms, but as often as you need to get screened and checked, you should go ahead and do that. Okay, and then I think she was also talking about money being good. So I'm guessing that the screenings, does the government, is there anything the government does to kind of provide subventions on it? Is there any affordable way that people who may not be necessarily, should I say, necessarily able to afford it financially in the private hospitals? Is there something that government hospitals offer to help with the screenings and all that, so people can also know about these things and take them up? So,
okay.
Dr. David, I guess you can enlighten us on that before we go back to Dr.
I
Shangris.
bit of the conversation while I was trying to join back in.
Okay.
I would answer those questions if asked, but just to weigh in a little bit on the diet part. Now, yes, ideally there is no particular set of food that quote unquote causes you to have cancer directly. Same way, there's no particular set of food that stops you from having cancer directly. Okay. However, some foods have a higher risk of having or predisposing you to having cancer, especially the colonic cancers. Now, food like processed meat. So here comes the sausages,
Okay.
your bacon,
Oh, okay.
high intake of red meat. Alcohol also falls in under the food category. It can increase the risk of you having cancer. However, to say you cannot have a sausage once or twice here and there, but a constant making it your daily staple meal is what increases that risk.
Okay.
Yeah, so you can still have them for a minimal moderate level. It's still safe, but then when
Okay.
it becomes you cannot lunch without one or two sausages. You can have breakfast without bacon. These are meals, and then sometimes the preservatives that they use for this food aren't so compatible with our body. Over time, it's can cause some sort of changes, and then
Okay.
um, for example, somebody who has an ulcer, an endoscopy confirmed ulcer, who keeps on having spicy food, drinking alcohol. Over time, that ulceration starts to change and can become something else. Because an
Okay.
ulcer is healed, there's not healing. So now you
Okay.
have a wound that is not healing. It's a small scab, but then you keep on peeling and scratching and peeling and scratching, and you do this continuously. Slowly, that wound starts to get deeper, starts to get wider. So same thing
Okay.
happens. And then, of course, there are a lot of, the body is trying to always repair itself, and it's always things to help fight off and repair itself. But then that constant repairing and breaking down, repairing, breaking down, basically becomes the formation of the cancer also. So that is where food can affect, what we put into our body can have a nasty effect and predispose us to some of those cancers. And with testing, most expensive is screening. It's actually the money.
Sorry, can you say that again?
The most expensive part with cancer, it's the treatment, not the
treatment, not the prevention. Yes. Okay.
Now, for a lot of facilities that do have them, HPV vaccines are not so expensive. A mammogram is not expensive. A prostate scan, a PSA is not so expensive. Cancer markers and cancer prevention, which we'll talk about as we progress, they are not so expensive. But then it's a different ballgame when the cancer has now been confirmed, or the cancer was ignored, and it's now a advanced stage.
Yes.
Now you're trying to combat chemotherapy, you're trying to do radiation therapy, you're trying to do surgery and combine all of them together, and then the real money. But at the preventive stage, it's not so expensive. There are some government agencies that have, tried to partner up with hospitals or private or semi-private organizations. Some NGOs try to make HPV vaccines available and relatively cheap. Also, people, organizations, NGO, they do pap smear screening, maybe and it's almost free. It's almost free or less than 5K for a HPV screening. That singular HPV screening that you do is a world of a difference between somebody that might have slight changes that could be cancerous, where something can be done, compared to somebody who then has a full-blown ovarian or a cervical cancer. From just that, so not doing HPV and doing HPV. So, yes, screenings are available for a lot of them. For a lot of them, and they're not so expensive. Most of them should be under 10-20K, most of them. Especially from facilities.
Sorry, especially for what?
Especially from government facilities.
Government facilities.
Yeah, I think in some government facilities they do breast cancer screening for free. I think so.
Okay.
Yeah. So
for the sake of our viewers, can you just mention a few, just so they know, if the ones you may know that do that?
It depends on the location, really. If I'm talking of some primary health care. So I think it depends on the state, but most primary health care centers do all those breast cancer screening. And for the sake of our viewers, I think Aproko doctor, I think it should be this week. He's doing HPV vaccine and this pap smear in Abuja, Nisa Premier Hospital.
All right.
Is this week? Yes.
All right. So I guess our viewers that are in Abuja can take advantage of that.
Yes. Let me be certain about the date. I think it should be Friday, Saturday, Sunday. Now, I'm not sure if it's this Sunday that just ended today, but give me a few minutes because our viewers may need it. So let me just get that information.
Yes, they will. All right. Thank you so much, Dietitian Grace. All right. So, and Dr. David as well. So while she confirms that for us, let's just proceed to check on other things like we've spoken about the foods, so I mean it's very comforting to know that there certain meats that we tend to feast on a lot can actually increase the risk of cancer, and it's better that we go on whole foods. Whole foods will increase our risk of cancer prevention. So that's very good to know, because sometimes it appears like it's a situation that we can't help. like some kind of, disease. Because like I said, when it happened to my dad, I just felt, being that there are hereditary conditions, in my, of course, I had some fears over time. Even till now, till hearing what you're saying now, I just felt there's nothing you can really do, to prevent it, because I know, like I said, how pedantic and how meticulous he was when it came to the things he ate, and his yearly checkups, and even to the doctors that he would even go for checkups at their places of practice. So this is very comforting to know, not just for me, and I guess for the viewers as well. So let's also digress a little. For those who already have the habit of taking alcohol and cigarettes, does that naturally increase the risk of cancer?
Short answer,
Or can they play with it, sort of?
Short answer, yes. Short answer, yes. Long answer,
Okay. Sorry, you said yes.
Short answer, yes. Long
Okay.
answer, so yes.
Okay.
Both smoking and alcohol has been linked to causing a variety of cancer.
Okay.
Although smoking cigarettes has been implicated a bit more.
Mm.
No, it's a risk factor for all the cancers. Smoking is
Okay.
a risk factor for almost all the cancers.
Okay.
From lung cancer to you name it. It's a
Yeah.
risk factor for almost virtually all cancers.
Okay.
Alcohol can also cause cancer or
Okay.
increase causing cancer.
Okay.
But usually with these things, it's usually from an exaggerated or a constant use. So somebody who is a social drinker who has a glass of wine once in a blue moon, once in 2 weeks, once in a week, is not as high risk of having cancer as compared to somebody who does 3-4 bottles every day or every 2 days.
Okay. That makes
So
sense, actually. That makes
yes, there is that risk associated with and with smoking cigarettes.
Yeah.
Increases with the higher frequencies, with the frequency, with also increased consumption of
Yeah.
So we usually advise people to stop as much as can stop, and for those who cannot stop, find it very difficult to stop, to at least cut down significantly. That rate and the risk associated with them also reduces greatly.
Okay.
But
So
yes,
just to
there's a very strong risk has been researched, in papers researched and written that is outlining, direct links between alcohol, cigarettes, and a couple of cancers.
Okay. So
But
just to
also,
reiterate what,
yes.
yeah.
So,
Sorry, no, carry on. No, I was just trying to
Uh,
reiterate what you were saying because of the, being audible enough. Yeah. So just for them to know what you're saying. So what Dr. David is saying is that for anyone who is already, a habitual smoker or drinker, the risk of cancer is much higher, for you than somebody who doesn't take these things. And of course, also it increases more when you are taking it more regularly, than other people. So taking it maybe like every day, being a smoker every day, like somebody who has an addiction to it, the risk of cancer is higher. So what is encouraging is that you try to reduce, if you're not able to stop it, you try to reduce the number of times or the quantity of cigarettes that you take per day, as well as the amount or quantity of alcohol you ingest daily. So just to bring that out. That's Shangris, welcome back.
Thank you. Unfortunately, it was Friday till today, ended today.
Oh, okay. Well, against next year, I guess people are better. So maybe next year we'll be able to inform them ahead of time. Sorry, Dr.
What?
There are a lot of these initiatives. There are people.
Okay.
Yeah, there are a lot of things actually to look out for. Yeah, it's to look out for. It's important.
Okay.
Yeah.
Okay. All right.
Pretty much every other month, there's some organization or one body,
Cancer screening.
So always just be on the lookout to go for whichever That's to you.
Even some hospitals actually come up with a program to do the screenings.
Okay.
Yeah.
Okay. All right. Thank you for that. So I'm sure our viewers have heard that. So moving on. Does being overweight also increase the risk of cancer?
Yes.
Being overweight
Yes.
as well. So okay.
To that.
Okay.
So obesity has been linked to about 13 different cancers.
Okay.
Yes.
What are they, please? Can you just
breast cancer,
breast
colorectal
cancer?
Pancreatic cancer.
Okay.
I can remember those ones off the top of my head because also those are the most common ones that plague us.
Okay.
Pancreatic, endometrial cancer, colorectal cancer, they have a strong link.
Oh. Okay.
Yes.
Okay.
Doesn't mean every obese person is going to have cancer, but people who are obese, as compared to somebody of a smaller build, they have a higher risk of, especially these particular cancers.
Please.
Sorry, Dr. Grace?
Sorry for cutting you short, Dr. Dave, but I'm just saying please to our viewers, because you're hearing that obesity is linked to cancer, is no reason for you to seek for fast solution, like quick solutions, because in that process you could be ingesting something that will worsen the situation. Please.
Yes. Thank you for that, actually.
At length the other day. I'm sure our viewers are a bit covered on.
They'll be more careful about it. I hope so. In fact, those things we spoke about the last session, those injections people take for weight loss and the other procedures they do, would also has there been any research to link cancer to any of those measures? No. Yeah. Okay. All right. Okay. So they are good then. A little. Yeah. Okay, Datisha Grace is not giving me the eye. Sorry?
Is there any research linking them to cancer?
Well, there is some studies that say the SGLT2, because those are affecting the functioning of the pancreas.
Okay.
The insulin-like, the shot, the injectable. There has been some links that they can affect gastric mobility.
Okay.
Now, the pancreas is already supposed to function at a particular set level. You doing something else that alters that functioning can, predispose some further changes in them. And of course, anything at an abnormal level can, also flip and becomes cancerous.
Okay. Wow. So it's a very sensitive situation that we have. We just need to be very careful. We can't be too careful, really, about the things we do to.
I was going to say that we can't be too careful, really. We can't be too careful. We can't be too careful because there's just a limit to what we can do as humans, right? And some things can just be exhausting.
Yes.
Imagine a situation like in your case where your father was careful and he still came down with cancer. Those things can actually be enough reason to just, what's the sense of all of these struggles, right?
Of course, yes. That was just what I was telling Dr. David. I mean, for a while, for some years, I lived with some level of fear. Because when I looked at his life, like I said, I couldn't think of anything. Even when we had birthdays in the house, he reluctantly would eat cake. That's to show you how really careful he was. He would reluctantly, and he died at the age of 62. So these things I'm talking about were things that happened when he was like in his, he wasn't old. He was still, literally like, quite relatively middle ages. Let's put it that way. So it really put a lot of fear in me for a while. I won't lie. I had that fear and just kept praying, and I said, hey, let me turn to faith. That's the only thing I feel can help me, to overcome this issue. But I'm glad to hear that there are things one can do. And also with the regular screenings as well, the best we can do is to try to reduce the chances, and we leave the rest, to destiny, I guess. Okay, so now we've been looking at how to prevent it. Now, for those who are actually dealing with cancer, for those whom, you know, it has happened to, what kind of lifestyle changes do they need to incorporate, you know, to help prolong their health and to help prolong their life? Because, you know, it's a terminal ailment. But like Dr. Changris also said, there are people that actually survive cancer. You know, so what are those things that you can do to increase your survival of cancer? So let me start with Dr. Changris. Now, Dr. David has a lot to say. So Dr. Changris, on your own part, what can help people to survive cancer, those that actually have it now?
Okay. Aside food, mindset, because I see that really goes a long way, right? I was listening to one lady that survived breast cancer. She's a nurse. She was saying how within her, she had a faith. She felt, I can beat this. So she was getting the adequate treatment she needed. So she kept backing it up with the mindset that I can do this, I can beat it. Why that mindset is important is because the whole process of the cancer treatment is exhausting. It's mentally draining. You go for a section of therapy and it's as if you lost yourself in the process. So it takes a lot of, let's say, affirmation or optimism to, you know, brace up and be like, okay, this is the process I have to go through. You know, sometimes you really can't explain it because you don't have the experience. So even what we are saying here, we don't have the experience. So we're talking from people we know that have experienced this. Is a whole lot. It's draining. It's draining. Okay. So that mindset, then when it comes to lifestyle, because the essence of the whole chemotherapy treatment is to recover. The whole cancer treatment, I mean, is to recover from the whole cancer, right? So one thing it does is that the immune system is being affected at that point. So we are looking at a way to make sure that your immune system is good. You're able to tolerate the treatment complications, because there are outcomes of the treatment. Some people, they lose appetite on the process. Some people, nothing is exciting again. So for somebody who is in that state, what am I going to eat? What do you want me to actually? Food is not interesting. So why are you telling me this, right? But the essence of all that is, you know, when the immune system is down, with the whole treatment and all of it, it becomes more difficult. And that's one of the things that happens. So sleep is one habit I would recommend for someone already going through that process of treatment. Sleep, because sleep has a way of healing us, helping our immunity. Right. So when you're able to get that adequate sleep, really, I know mentally it's exhausting to even sleep because you're in pain. So getting that adequate sleep a whole lot. But when you are able to, please do try to get the sleep because you need it. Then when it comes to your food, I would say don't entertain fear. Don't entertain fear, because there's just a lot of information. Don't eat this, don't eat that. Look for wholesome foods to eat. Wholesome, and you're talking about foods that are rich in fiber. You have your healthy fats, you have your protein, you have all the nutrients encompassing, right, in one meal. At every meal you should have that, okay? Because why do you need protein? Why going through the process of treatment for cancer is because there is muscle loss in that process. There is weight loss that is you can't explain. It just occurs. So the protein intake actually needs to be increased because you need to maintain muscle mass. Okay, you need to lean body mass, kind of. You need to maintain that. So when you're eating protein, you just know, okay, you need this. It's still a part of recovery. So you need adequate protein. And when you are having vegetables and fruits, have it at the back of your mind. Whole grains generally, have it at the back of your mind that you need it and the phytochemicals that are in this food that to help. Now, for somebody who is preventing, this is the reason you are having all of this. But for somebody who is treating, you know you need it to aid your treatment. Okay, you need it to aid the treatment to go well and really. When you're going through all this all the cancer treatment and you are eating adequately, it helps your recovery. Okay, and then if you're able to, some situations they can't exercise, but those who are able to exercise, I do recommend walk. You don't need so much of exercise. But there are some women I see on Instagram that are dealing with cancer and they are still at the gym. I'm like, oh my God, where did they get this strength from? It's encouraging, really, but
It's a
you don't need to
mindset,
do so
yeah.
much. That's the mindset again. You
Yeah,
don't need to do
we're
so
talking
much.
about.
If it is the work you can do, 20 minutes,
Yes,
10 minutes,
yes,
30 minutes,
yes.
just like it's recommended, 150 minutes of exercise weekly. So you can spread it 30 minutes, 4 to 3 to 4 times weekly, whatever you can do, really. And love, love heals.
Yes,
Sorry,
it
sorry,
does.
I'm
It
debating
does.
from nutrition, but love
No,
heals. Okay, so now
it's everything together. Yes.
this is to the caregivers. Okay, they need all these people need all the love they can get. They need all the empathy, and to
Yes.
even with the medics.
Yes.
If you're opportunity to come across someone going through this process, all they need is love. They don't need judgments. Okay,
No.
just like we already know, processed meat is linked to cancer. Okay,
Smoking,
alcohol is
drinking.
linked to
Yes.
yeah. So, but when somebody is going through this process, for me personally, when I'm already managing somebody treating cancer, I don't even go asking you, do you use to take alcohol? I don't go that way because it's as if you're judging these people. So you don't need that. They don't need that judgment at that time. Just show love, show empathy, anything you can to help them. Please do. That's for caregivers and the people going through this. I really do hope you come out of it. It's a lot. It's a lot. I really do hope God sees you through.
Yes. Thank you, Dietitian Grace. Okay, Dr. David. So for those who actually are dealing with it, what can they do to increase their chances of survival?
Okay, well, Dietitian Grace has basically touched on most of it. The American Cancer Association has researched strongly on lifestyle that help managing cancer, and one of the recommendations that they had is physical activity.
Okay.
As simple as just brisk walking 4 times a week, it's excellent. Maintaining maintaining a healthy weight.
Yes. Okay.
So maintaining a healthy weight.
Yes.
Just mentioned a lot of the therapy we do for cancer, be it the radiotherapy, be it the chemotherapy. Chemotherapy, especially, well, chemotherapy does is that it tries to attack the cancer cells.
Yes.
However, in attacking the cancer, goes after the cells that are also healthy.
Oh, okay. Okay.
So a lot of people that chemotherapy, it's like people who have chemotherapy end up losing hair.
Yes.
So usually every fast generating cell is affected with hair. The cells are fast generating, so people on chemotherapy hair. People on chemotherapy tend to lose a lot of weight, even just from the chemo itself. Not even just, and the cancer is doing its own bit, the chemo is also doing, making sure you maintain a healthy weight and you don't lose so much weight makes a whole lot of difference. It makes you tolerate the chemotherapy, keep your fighting chance and survival chance to maintain, a steady weight. And then also limiting things that can further worsen the cancer. So you already thought this is not the time to start smoking. It's not the time to drink alcohol. It's not even the time to drink alcohol. It's possible. You have to also make sure when you're eating, it's not the time to say, well, I already have cancer, so let me eat whatever. No, please, this is the time to actually eat.
Sorry to interject. Now, what you're saying now about being mindful of what you do, it doesn't matter the stage of cancer you have been diagnosed, to be at right now. You just need to make sure that everything you're doing is doing these things that you have said.
Yes. It doesn't matter the stage. It doesn't matter because people have come back from stage 4 cancers with.
Oh wow! Okay.
Yes.
Okay, I didn't know that. I didn't know you could ever survive it when it gets to stage 4. I thought it's terminal at that point.
A lot of people survive from 4 cancers.
Just like people surviving failed kidney now. Yeah, you can survive it.
Okay.
Into remission, a lot of people
at any time.
Hey, don't give up hope. Don't give up the fight. just keep up doing everything as though you're seeing the finish line.
Yeah.
Living healthy as though in a week or in 2 weeks the cancer is going to be gone. Even though that's been on for 2 years and it doesn't seem to be approaching, but you still
Okay.
all of those things because it helps overall for the treatment, for survival, it helps overall. Sleeping also helps because
Sorry, sleeping.
sleeping, like we spoke on
So
one of the segments, like
yes.
we spoke on one of our segments, we talked about how
Okay, sleeping. Yes, sleeping, resting, sleeping, resting.
so
Okay.
remember how we spoke about how sleep is associated with stress and how
Yes.
stress affects the immune system. Now,
Yes.
cancer already has a lot going on with their immune system.
Of course.
Therapy, the chemo is breaking down their immune system and rebuilding it back up. People like this need to sleep properly.
Yes.
This is not the time to stay up at night or stressing and further put you under a stressful situation would reduce your immune system and that would make the cancer a bit worse.
Yes.
So good quality sleep, rest, limit or cut alcohol completely. Do not exercise, maintain a good weight. Also ensure you're not taking processed food as much as possible. It makes a world of difference. It makes a world of difference.
Just to ask, what the survival rate of cancer? Do you have like a percentage of it?
So it depends. It depends.
Okay.
Survival rate, to some extent, is location dependent.
Okay, location, okay. And also maybe the kind of treatment you're receiving as well.
Also the type of cancer. So somebody who has cancer in a place where all the resources are available does not have to worry much about financing. He does not need to struggle with looking for a center that has a functional machine for radiotherapy.
Yes.
It's, better chance than somebody who is with those problems.
Okay.
Also, with cancer, what ends up being the problem most times is the late detection, which is what this part of our world. In this part of the world, we usually detect cancer late. By that time, it spread to other organs. It has already taken a severe toll. Somebody might have already had a cancer process that started a year ago.
Yes.
And it's just going on. And nobody thought they probably did not have the money or the information. Because sometimes, even apart from money, information is also another aspect of it.
Of course.
So the prognosis changes with certain factors. A cancer that is caught at stage 1 has a weak prognosis than one that is caught at a stage 3 or a stage 4. Because one is confined locally to the particular organ. In fact, it does not spread to the lymph node. It's just buried in that organ spread. You can easily cut out the cancer, maybe cut out some of the tissues around it, and the person is fine. And the cause of chemo, nothing too serious, and the person is otherwise fine. But then now you know that is at stage 2, stage 3. Even if you're going to do a surgery, now you're going to do a more radical process. It's just, for example, somebody who has a breast cancer, if it's just a little lump on the breast that's cancerous, the full breast, it usually just cut out that lump, and then that's about it. The person gets some chemo, that's fine. Now, if the cancer has eroded the whole breast and spread into the lymph nodes, and you want to do surgery, now you have to take out the entire breast completely. You have to go into and take out all of the lymph nodes, as many of the lymph nodes as possible that you can see, just so you try to limit how much further it will spread. And even that whole removal of the muscle, the tissue, all of that, now is putting the person at some disequilibrium. So somebody who has a surgery that just removes a lump compared to somebody who has full radical mastectomy, they have different levels of possible complications from the surgery alone, even. Not to now even go back to the cancer itself. So the prognosis greatly depends on how early it's caught, and
Yes.
also fast intervention is started. A
Yeah.
lot of cancers, if picked up on time, people do very, very well.
Yes.
I have friends whose parents got cancer. It was picked up very early. They got treatment early. They're in remission. I lost an aunt recently who had cancer, but we didn't know for a while.
Oh, sorry about that. Yeah.
The things found out. We did what we could, but it
Yes.
happened. Yeah. So it depends on how early it's caught and then how early treatment. But if it is found early, the prognosis is very good. For literally almost all the cancers, even the ones that are rapidly progressing, if they are caught with timely intervention, we see a lot of good results. A lot of good results.
Okay. Is there like an age where there's a higher risk of contracting it? Is there a particular age?
Yes, I would say yes, because depending on the type of cancer. Now the body goes through normal changes. So, for example, is why I would say men who are above 40 or above 45 should start getting prostate screening done.
Okay.
It could be once in 2 years. So, be a PSA, get a prostate scan done. If you're not having any symptoms, just for regular screening. It's also, I would say, women who are above 40 also should start getting breast scan and done. We could do this yearly or every 2 years. Would say people of above 25 should start getting HPV and cervical screening done every 3 to 5 years. Because, example, now the body releases hormones, progesterone, and this causes growth. It causes growth. This uterine growth is normal. The body has a compensatory mechanism by shedding the endometrium and women having their normal monthly periods. However, when people get closer to menopause, the hormone changes are not as they used to be anymore. The protective mechanism that the body has is not as high as it used to be. So now the onus is on you to do regular screening, because even somebody that has a family history or not, yes, the family history predispose you, to
That's
cancer.
people like me.
Yes.
Yes.
But
people like me. Yes.
Not any family history at all. No family history whatsoever. Nobody in the family has it. They can also just randomly get it, which is this is the point where screening comes in, and also vaccine.
Okay.
But some cancers are preventable if you're vaccinated for them.
Okay.
For example, there's HPV vaccine. It might not be readily available everywhere, but it does exist. It might be a bit pricey from private facilities, but it does exist. And this HPV vaccine reduces at least by 70% the risk of cervical cancer.
Okay.
There's hepatitis B vaccine.
Okay.
And hepatitis B vaccine can reduce very greatly the risk of having a liver cancer.
Okay.
But the hepatitis virus itself is one of the risk factors of a liver cancer.
Okay.
So who have already gotten vaccinated for hepatitis, most cases not come down with hepatitis. You've reduced already what risk factor. For a woman get the HPV vaccine, you have reduced one risk factor.
Of cervical cancer.
For cervical cancer, and then you try by not smoking, you reduce further risk of other type of cancer. Yes. So vaccines do also help. There's also a role in prevention of some of these cancers.
Okay.
But the key is always early detection.
Okay. It's not common in children, right? Toddlers, babies.
Not really. Although there are some cancers that affect. There are some cancers that affect children. So children can commonly have jaw facial cancers.
Okay.
But a lot of those cancers for them is not really because of any risk factor that is explainable. It's one of those things that just happens. It's not usually because of course, they're children.
Their babies,
They
their children, yes.
smoke, they don't drink alcohol, they do not have any infection. In some cases, it just happens. Now that's the other part of cancer. That is the part that feels like you cannot do anything about.
Yeah. I mean,
That is so,
That's
sorry,
the
okay.
that's the
painful.
part that is so beautiful.
Painful, yes. Yes. Just, it's, like a short story. When I had my son, I had him in America. So he had a heart condition. He was born with heart defects and he required 5 surgeries. So we spent some time in ICU.
Yeah.
So I remember this little boy and the mom. If I talk so much, it's very, very emotional for me. I can still see the little boy and his mom. There was no treatment for him. You could see chemotherapy had taken off all the hair, and they were just waiting for him to go. So what they were doing, the nurses will come. They had clowns that will come every day. They'll give him balloons. They'll give, just to, keep him happy.
Yeah.
For that time. So such ones now, you just tend to wonder, how could it have been prevented? Especially the moms. You will start thinking, did I do something when I was pregnant? With this baby. I could see the mom, but I think over time she came to accept that it wasn't her fault. Of course, at that point, faith is very important. And that was it. So, until we were discharged, the boy was still there, but they just tried to keep him happy. The pediatric nurses and doctors and that were coming around to just check him, but he had been taken off every treatment because they were just waiting for him, so it's a very sensitive and emotional, topic, so I guess, like you rightfully said, I was just thinking maybe with children, is there something that one could also do to prevent their own? But like you rightfully said, in those cases, it's quite helpless because you can't say don't drink, don't smoke. They are babies, they are children. They don't, they were just born with this thing, and that's it. And you still see them suffering this chemo. Some you see them. It's a very horrible. If you ever sit in the hospital, for you people, I don't know how you do it. But spending time in the hospital, just that short period, it makes you thank God for life, and it really makes you, it humbles you, it really humbles you. So, all right then, thank you very much for that, Dr. David and Dietitian Grace. I think we've even gone past our time. It's a very sensitive topic, so I just wanted the public to be, as much as they can be educated about preventing it and managing it, because it's something that, today you see someone, tomorrow you hear, oh, the person passed, and you didn't even know that they were dealing with cancer. I just said it was cancer, and so it has become like, what happened? He had cancer. What happened? She had cancer, and you're like, this cancer, So I just thought it was a good time in this month, to talk about it, to see how we can, take measures. I, for example, I'm guilty. There was a time we used to do the cervical screenings. No, actually, I think I did mine last year. I haven't done the one for this year, but the vaccine that we used to take, there was a time that it was, I was doing it regularly, but I stopped. So this is kind of like a wake-up call, to the extent that one can afford it. Is good to go back to doing it, getting your screenings done, and at the same time, eating wholesome foods. I'm glad that we've discussed about these wholesome foods very, a lot on this channel. It doesn't have to be expensive. It can be very affordable, and you just eat, a balanced and healthy lifestyle with whole foods, not processed food. Sometimes I even think processed foods are even more expensive now than healthy foods, because if you go to eat out at the restaurant, how much you spend to buy, let's say, bananas or vegetables may not be the same amount you may spend to get pizza or SFC or Chicken Republic, and all that. So if you look at it, it's affordable. So somehow we can take charge of our health, and reduce the risks. So David, sorry, I can see that they're getting your attention. Let's not keep you any longer. You're at work. I don't know if you have anyone to attend to. Okay, so just any last words from...
work.
Sorry?
I said I'm actually done with work.
Okay.
something before we go. So
Yeah.
I worked in a pediatric oncology unit for some time, and I saw a lot of children with cancer.
Yes.
Um, with children, most times they can't really say anything. They can't explain what's happening to them, and they're really not to be blamed because most times they don't really do anything. The
Yes.
risk factors talk about, uh, they are not things that are within their purview to do something about. So things that people do that can reduce the chances of cancers in children. Don't smoke around children for one. But even secondhand smoking can be risk factor.
Okay.
Also, on us to have a great degree of suspicion
Yes.
because you notice something going, some subtle skin changes, you start to see some changes with a child. Please take them to see a doctor, let them get
Yes.
checked, investigation be run. Don't just say, oh, it's nothing, the child is just crying. It takes a great degree of suspicion because
Yes.
like I said, if it's caught early, the chances of complete remission is extremely
Yes.
high. Is
Oh,
extremely
that's
high
good.
compared to the cancers that we got late. And also something that a lot of us might still have in our that is implicated in cancer is asbestos roofing.
Okay.
The
Asbestos.
the asbestos roofing sheet we used to use those days in the past. I know not a lot of people have fully transitioned to now POP species, but the asbestos roofing, the asbestos material itself, has been implicated with a lot of lung cancers and
Okay.
white cancers. So have the ability and capacity to change their roofing. Please, if you're using asbestos, try to change that. If you're house hunting, you should also pay a close look at what type of ceiling,
Yes.
is thing you're looking
Yes.
for. That too can affect your health.
Yes.
And there are people who are smoking around you. You might not be the person smoking, but even just being around that mist of the second-hand smoking, that too can affect you greatly. But
Okay.
with early detection, regular checks, we would do better, and because of having it becomes a bit slimmer. And then even
Yes.
if it does have it, if it's caught very early, it's very easy to treat. It's not to treat a stage cancer than it is in stage 3 or stage 4. Because
Yeah.
at those stages, you're not only treating you're treating the after effect of the cancer, you're treating what the cancer has done to those organs. The cancer liver, for example, now you're not only treating a problem of the cancer, you're now treating liver failure.
Yes.
So there's now liver failure, there's now the cancer together
Yes.
with it. But my problem is skin that could easily just have been cut out, dressed, treated with maybe 1 or 2 sessions of chemo, and everybody forgets about it and just does 6 months yearly check. Now becomes something full blown, and then there's now 6 cycles of chemo. If that doesn't work, you try another 6, you do radiation, you're doing blood transfusion in between hospital admissions. Cancer can be a daunting diagnosis, even in developed countries. However, early detected cancers are way better than those who are found out late.
Great.
And
Yes.
that we can do to prevent and to reduce greatly the risk of developing these cancers, even if you have family history of cancer. And for people who have family history of cancer, it is not a death sentence. What this just means is that you have to be a bit cautious. You have to now take more proactive measures. Go for your screening. It might be breast cancer. Don't say it's only breast. There's nothing wrong with your breast. Do a cervical care, you know, get the HPV vaccine, check for cancer matters, routinely, regularly. It doesn't have to be every 3 months, once a year, once in 2 years, once in 3 years. Just do them and then, get that clean bill of health and be sure truly
Yeah.
there's not, as opposed to just assuming and then something is actually just growing slowly and steadily in the body.
Thank you so much for that. Thank you. Dietitian Grace, any last words for our viewers? I know it's a sensitive topic for you. It's well.
I would just recommend that we do the annual checks, okay? Because that early detection is really important. It's really important. 2020, I lost my best friend to cancer, breast cancer, and
oh dear. Sorry about that.
was a whole lot, and she was just 25. So you could be saying you're young, but just like Dr. Dave said, he worked in pediatrics oncology ward, and their children, for no reason, these things happen to them. So imagine we that have been exposed to factors that could actually risk us, right? So you don't have to say, I'm too young for this, I'm too young for that, right? So what actually made my best friend not to survive it wasn't dictated early. If it was dictated early, believe me, she would still be able to be. So I really do recommend, do the screenings. You don't have to wait for any symptom, really. Just check. She didn't have any symptom. You just, boom. So please, that's what I would recommend to our viewers. If you have the opportunity to screen. And one of the things I've noticed about screening is a lot of people are, it's expensive. You don't know how much they will call for you in the hospital and all that. Just go. You may be surprised that it's something that you can, like, it's a money you can easily go do away with, right? So if you don't ask questions, you won't know. You will just be assuming a lot of things. Just ask questions. If it is expensive, there is still another place you can afford within your environment. Just ask questions, really, because if you're not talking to anybody, you may not really know what's happening in the hospitals, right? I've worked in the hospital for 8 years, and when some people come and they're like, I thought to see a dietitian is so expensive, and like, really?
Yes.
So some of these things will surprise you to know the cost. Some places you actually get it for free. So look out for organizations that are organizing free screenings, and don't be ashamed. Don't be ashamed. Just carry your matter for head. You don't want, please.
Of course. Why should you be ashamed? Yes, you're right. Why should you be ashamed? Yeah, thank you so much. I appreciate you both for that. I mean, I hope that as we broadcast this, I'm sure a lot more people will be able to watch or listen to what was discussed today and be able to incorporate some lifestyle changes that would help to prolong their lives. Because, we're here for each other. We're here to encourage healthier living, and we're here to also encourage wholesome living. We have various, provision that, our maker has made available for us to tap into and be able to live good lives. So I hope that from these sessions that we have, people actually listen to them and try to do what they are advised to do here. I'm very sure that you will see that things are better for you. For me, I do, and like I always say, I've not regretted these sessions. These are something that I feel like I said these sessions for me, because I really am very blessed, from them. So thank you, Dietitian Grace. Thank you, Dr. David. Till we see again next month. I wish you both a very blessed a month ahead, and also our viewers have a very, very lovely evening and a very lovely week ahead. All right, take care, everybody. Bye.
Bye.
Bye, Dr. David.
All right, take care.
Bye.